we're hoping to address most of your questions through that method. But I will go to some that seem to be coming up very frequently. And the first one is the staff and the dentist can all wear proper and recommended PPE, but how are the patients protected from aerosols created from previous patients? And I think they're referring to that aerosol virus might be in an aerosol for a specific amount of time before it settles down.
Yeah, I can take that, and Kathy, you can chime in if you like. That is why, for right now, both the ADA and the CDC and many state boards of licensure and health departments are recommending that you limit aerosol producing procedures. And at such a time when it is safe to do that again, you have to think that there will be a lot of testing that's going on, so the community-based transmissions are reduced, that there are not so many people out there in the population that have this infection. Those that are testing positive, there'll be contact tracing to identify people who need to self-isolate during any potential incubation period. You'll see hospitalizations go down. We'll certainly see, the deaths no longer occurring at any type of a rate that would be concerning. So now you've got a situation where it's unlikely that you'll be treating a patient who may be infectious with COVID-19, and it'll go back to more, the precautions will be more like what we do for patients that have measles or chickenpox. You need to ask those questions all the time when patients are coming to visit. Have you been ill? Have you been exposed to somebody who's ill? And kind of figure out whether or not their treatment needs to be delayed. And, and that's really where we need to get to where, we can't control how many cases are out there. We also can't know how many asymptomatic or pre-symptomatic cases there are until the public health has the capacity to do the testing and quarantining and self-isolation that's necessary to control the spread within the population as a whole. Do you have anything to add to that, Kathy?
Well, I think the other thing too is there are still many questions and answers about this virus. And also in terms of aerosols, we have limited evidence relative to dental aerosols and how long something may remain suspended in terms of the current SARS-CoV-2. So I think we lack a lot of that evidence right now. And so it's difficult to predict, say, how long you would leave an operatory open after cleaning and disinfecting it before you'd bring another person into the room. Those are still some unanswered questions that we have. And I think that's part of the challenge right now in terms of, as we go back, what science do we still need? What answers do we still need to have?
Thank you. Do you have any recommendations for front office staff? Should your front office person or persons be wearing masks or have shields?
I think for right now, for front office staff, you want to practice the same social distancing that they are in any other workplace, which is wear a face covering. If you probably wear a face covering because you don't know if somebody's going to accidentally approach you, and get in too close proximity with you. Spread out the number of people that can be, spread out the people that are in a waiting room and the number of people that can be, and limit the number of people that can be in there. And if you do have an issue with, say, a counter or a window or something like that that's kind of close to the area where the patients are, you could put up a plastic barrier or guard. You can also do markings on the floor and ask people to stay, at a safe distance when interacting with staff. Do you have other thoughts about that, Kathy?
Sure, and I mean, I think there are a lot of dental settings today too, where patients actually come in and there may be an iPad or something else or a computer, and they're actually at that point sort of registering in, and that should be at a distance, and also to aseptically manage those surfaces after a patient would check in that way. So I think those are some other things, as well as the shields and face coverings for your front office staff.
Thanks. We've gotten several questions related to wearing gowns. So could you tell us how often someone should be changing the gown? Does the gown have to be disposable? If it's not a disposable gown, how is the laundering handled?
Well, in terms of gowns, whether you're wearing a disposable gown, a reusable gown, that gown, if it actually becomes wet and soaked through or overtly contaminated, needs to be changed. So that's a performance-based approach. If you are using what's called a single-use gown, and it's labeled as single-use, that would be a single patient-use gown. So those are sort of those categories. The other part of it is if you are performing procedures on a COVID-19 positive patient and you're generating any aerosols of any kind, then that definitely would need to be changed after those procedures are being performed. And there's guidance both from CDC as well as regulations from OSHA on that specifically.
Yeah, there's a question about the review of the medical questionnaire recommended by OSHA for the initial fit test. In this age of COVID, it might be difficult for your staff to see their physicians to have it reviewed. Do you have any recommendations about that?
Well, I can tell you what we've done, because we're, of course, treating emergency patients and making sure that the faculty and the staff who are doing that do go through the process. We reached out to a local occupational health clinic and asked them if they could do those reviews for us. And so we've been able to send the questionnaires to them, and then they do the review and let the person know whether or not they need to come in for the medical exam. Most people don't, but I'd say maybe about 5% of the people that we've tried to fit with N95s have had to go for the medical exam. And once they do that, I think all but one have cleared. And that's another issue with using respirators routinely, is that you have to remember not everybody can use them. Some people, due to the size or shape of their face, they can't be properly fitted, and others may have medical conditions that prevent them from being able to wear an N95 respirator, because it does impact your breathing, which can have an effect, on other systems in your body.
Do you have any recommendations for hair or foot coverings?
Currently, there are no recommendations in dentistry for the use of hair and foot coverings. I'm not sure if that will change or not. I can't really predict. But Kathy, you have any thoughts on that?
Well, if somebody's performing oral surgical procedures, then that high clean technique, many times you would see individuals wearing hair coverings and foot coverings.
Okay. That's true, but not routinely in dentistry. I haven't seen any recommendation.
No, and there's
that would change. No change in the recommendations regarding when foot and hair coverings would be indicated.
Correct.
Okay. There's some concern, in the normal practice of dentistry, a dentist may be called out of a room to check a hygiene patient. What's the expectation for replacing PPE for these kinds of situations? Do they need to redo everything, new gown, new gloves? Well, of course, new gloves, but different mask?
I guess some of that might come in to how you're actually scheduling your patients. The idea would be that you wouldn't want to leave the room. You wouldn't want to need to remove personal protective equipment to go to do a check. And is that check really necessary? I guess that's the question. I think you'd have to work that out in your specific policies and procedures, because once you begin something, it's best if you stay in that room to complete the procedures. Eve, do you have some comments on that?
No, I think that, the idea of going from patient to patient, nothing's really changed, other than I believe this might be a situation for extended use of a mask if you have a shortage, but only temporarily during this period. That, normally you would change your mask going from patient to patient. And perhaps if you currently have a shortage, or you're trying to do extended use of a respirator because you have a shortage and you need to use them, that might be the exception.
Okay, we're getting also several questions related to different techniques on preserving the N95s. Do you recommend placing a surgical mask over the N95? Do you have any recommendations other than maybe what you went through here, that additional recommendations, I should say then, on preserving N95 use?
I don't specifically, and I think the difficulty with that is that all of these recommendations are based on somebody's best guess as to what will help you extend the use, and so they're not evidence-based, I guess is what I'm trying to say. So I don't know whether or not putting a surgical mask over an N95 would have any effect. I would assume if there's enough fluid resistance to the surgical mask, it may provide some protection, but I also don't know in what way it affects the breathability of the N95. It may cause an additional problem. And the same goes for decontamination. There are some decontamination methods out there that have been studied in terms of reprocessing and reusing an N95 respirator, but the ones I've seen so far that have been able to do some validation have been processes that aren't necessarily available to us in dentistry, such as vaporized hydrogen peroxide, which is the use of a cold sterilization machine that vaporizes hydrogen peroxide, or use of ultraviolet germicidal irradiation, which also we don't have that at the dental school, and I don't think any dental office has it either. So, the reprocessing, I've seen people attempt to reprocess N95 respirators, but there's not very many methods that look promising for that.
Right, and there was some updated guidance on the CDC website that was posted on the 22nd of April specific to that topic. I think the other thing to think about, if you're putting a surgical mask over an N95 respirator, you'd still need to be doing the self-check on the N95 to assure that it hasn't adjusted the seal.